We have a veterinarian on the show today. Dr. Lisa Peters is back, and we have Rosie's dogs. All three are yours, right,
Yes,
Rosie?
they're all
Can you
mine.
introduce us to
This
them?
is Bello right here. I named him because Bello means handsome in Italian, so he's handsome. And then this is Ace. He's getting real comfortable, as you can see. So this is Ace.
He wants
right
his
here.
belly rubbed, I think.
Yes. And then over there we have Hazel. And I named her after her eyes because she has hazel eyes. So I thought that that was the perfect name for her. And she's real like mellow. They each have their own personality, like children, you know.
Yeah.
Every child is different, so each dog is different and they serve different purposes.
Well, it's fun to meet your pets, but we're also have an important topic to discuss, and that's keeping your pets healthy. And Dr. Peters, she's a veterinarian, by the way, with Fox Valley Animal Referral Center in Appleton. And you say we really need to be sure that we are careful with fleas, ticks, and mosquitoes, and that our pets don't get them.
That is correct. I mean, these insects can certainly cause a lot of diseases, and so we want to keep them off of our pets and out of our homes. Fleas, for example, can cause tapeworms, and they can cause allergies in our pets. Mosquitoes can transmit heartworm disease, and ticks can transmit a number of different diseases, but in Wisconsin we worry about Lyme disease the most.
Right, so that's one thing. And then also heartworm. What do we need to know about heartworm?
Well, this is a plastic model of a dog heart.
I'm glad it's plastic.
It is, yeah. And it's,
Real glad about that.
filled with worms. And this is what it would look like if your dog got heartworm disease. And you can imagine if there were that many worms in your dog's heart, it wouldn't function very well. So it can be life-threatening. So we want to do a lot of things to prevent it.
All right. Can you see, there you go. Can you see that?
Yeah, people always
That is
say,
not-
oh, they're just dogs, but they don't understand that dogs also have, you know, intestines and the same in size as us, well, similar, but there are medical conditions they can get from not taking care of them.
So now we know what we want to prevent. How do we do that?
Well, it's really important that you get on a good prevention program and you talk about this with your veterinarian.
Yes.
And it's really important that you do it according to your pets and your own lifestyle.
Yes.
So Rosie, with your dogs, your flea and tick prevention program might be very different than someone who travels down south 6 months out of the year, or someone who might have the hunting Labrador. So it's really important that you talk about it every year with your veterinarian and just come up with the best program for your dogs.
Yes, absolutely.
Now, is this something that we only need to do in the summer when mosquitoes are out?
Absolutely not. I think that's kind of the misconception, especially in Wisconsin, is a lot of people tend to stop their flea and tick and heartworm preventative in the winter months. And we're finding that ticks are lasting well into the cold. Into the cold months, so we want to keep them on it.
Plus, they are tough little ones, aren't they?
They are. Plus, we take our pets with us places. We take them to the pet stores, and we take them to grooming facilities, boarding facilities, and there's lots of other animals there.
To a TV studio?
Yeah. And so
you never know what you're going to find here.
So we want to make sure that they're protected. And if you travel down south,
like
I think
us.
Rosie, you mentioned
We go to
that
Florida and we live in like in the acreage, so it's a lot of land there, and you never know where they end up or what tree or what bush they go under. So I keep them on year round,
Right.
and I actually use the pill and sometimes also use the liquid form too, just to kind of give it a double security.
Make sure they're really good. And what
Yeah.
about giving that same medicine to cats?
that you shouldn't do.
Okay.
And we see a lot of problems with that. People will put the dog medication on the cats, and we see a lot of toxicity problems with that. So you absolutely want to read the labels and do not do that.
Okay, and Rosie, you dressed yours up so nicely.
Yes, I feel like I've always was the type that was like, no clothing for dogs. No, that's crazy. But after a while, I see them shiver and I see them get cold, and I'm like, now I see why they do it.
They actually do need to be warm.
Yeah, so I have Bella in his little jacket with a hoodie. I thought it was cute, and he likes it.
They're very cute.
It's my biker dog. And
Well,
this one
thanks
has
for
a
bringing,
sweater, so
yeah, thanks for
it
bringing
works.
them in, and all of that advice was so good.
Yes.
So, Dr. Peters, thank you so much for being back.
Thank you.
And we just got to remember to keep that medication going all year round.
Absolutely. Thank
Yes.
you.